Hello, welcome everyone. Welcome to Healthcare Excellence Canada's Promising Practices to Enable Aging in Place webinar series. I'm Andrea Pichet, and I'm pleased to be your host today. Please note that this session is being recorded. This is the first webinar in a three-part webinar series, all featuring promising practices in Canada as part of the Enabling Aging in Place Collaborative. HEC has had the privilege of learning about so many great programs and initiatives to support aging in place. And we know that folks across the country are really keen to learn what others are doing. So over the next 3 months, we'll feature 6 promising practices to help spread the great work that's happening here in Canada. Next slide, please. We are pleased to offer French simultaneous interpretation by Boost Events, a subsidiary of Boost Lingo, for this session. If you wish to hear the voices of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you need support at any time during this webinar, you can reach out to tech support using the chat feature. We invite you to share your questions and comments at any point using our chat box in either English or French, and we encourage all of you to respond to the comments and questions that are coming in the chat as you wish. We'll aim to connect as many of your questions as we can with our speakers during the question and answer session that will be at the end of the webinar. But please recognize that we may not have enough time to answer every question. And so in our follow-up email, we'll include answers to everything that's been asked. The session is being recorded, and a link to the recording will be available next week for you to review or share with any colleagues who might have missed it. Next slide, please. Enabling aging in place is place-based work. Where we are matters. I'd like to start by acknowledging that we're meeting on land that's been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that we are broadcasting this webinar from Ottawa, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate the historic connection to the lands where we work, live, and play, and the opportunity to gather here today. I invite you to say hello in the chat, and please share the name of the ancestral lands that you're joining from. Next slide, please. HEC is proud to be supporting work to enable aging in place. When we started on this journey almost a year ago, one of our first steps was to find examples of where aging in place was being supported in a good way. Not surprisingly, many of our shining stars, they wouldn't find them in journal articles or even on web pages. We found them mainly through stories and referrals passed to us from one group and another. And when we compared the work of these programs with factors that we were seeing in the literature and the reports that were being highlighted as important for aging in place, we found that they matched. But we also found that some of the most impactful programs had additional factors that were common and also part of that secret sauce of why they were so successful. And so based on what we read, what we heard, what we saw, we created this set of program principles that are being used to guide our work in this space and that you're welcome to use as a bit of a North Star for aiming your efforts towards supporting aging in place. So starting at the top, we have 3 boxes that are horizontal across the screen, and these are our action-oriented principles that describe the actions that are needed to support older adults and care partners. And then the bottom of the diagram has our program principles that are value-oriented, that relate to how services are provided. Let's take a quick look at the first of the 3 action-oriented principles. If you could just move to the next slide. So the first is access to specialized healthcare services. We know that older adults and care partners, they need formal health and social care supports that are aligned with the needs, the resources, and the priorities of individual communities. The second is that we know that we need access to social and community support. We need services that help improve social connections, reduce loneliness, and social isolation. And the third is that we know we need access to system navigation and support. Older adults and care partners need a personalized approach to their system navigation where they're accompanied on their journey at the level that's wanted and needed by them. Next slide. Taking a look at our value-oriented principles, regardless of what services are being provided, we've learned that it's important that services are provided in a way that's adaptive and responsive to the individual needs of each older adult and care partner, and that they continue to adapt and respond as the needs change. We've also seen that it's important that we take a health equity lens and really focus on the structural and social determinants of health in terms of the services that we provide and the way we're providing them. And finally, that services need to be delivered in a high value way by optimizing resources that are used on health and social services in ways that relate to the outcomes that matter to older adults and their caregivers. Next slide. And so today, I'm pleased to host representatives from two promising practices that exemplify our Enabling Aging in Place program principles in a really beautiful way. From the Seniors Social Prescribing organization in Maple Ridge and Pitt Meadows, British Columbia, we have Joanne Leganis and Sandy Temple. Joanne has 4 decades of service to Maple Ridge and Pitt Meadows Community Services and is honored to lead as the Director of Administration and Services, specializing in senior services. From humble beginnings, Joanne has spearheaded transformative programs and secured vital funding, championing the well-being of vulnerable seniors in our community. Sandy has volunteered and served the communities of Maple Ridge and Pitt Meadows for over 40 years through her tireless advocacy, fundraising, and community building. She's personally raised over $75,000 for Alyssa's Wish Child and Youth Program to help young victims of abuse, and she helped countless families through her Christmas sponsorship and senior advocacy. And from the Nursing Home Without Walls program, we have Teresa Salmon and Suzanne Dupuis-Blanchard. Teresa has been with Nursing Home Without Walls at the Port Elgin site from the very beginning of the program in August of 2019. Her love and passion for seniors is the driving force that keeps her always moving forward, adapting, and creating new programs as the needs arise. Suzanne is the innovator of Nursing Home Without Walls for Aging in Place. She's a registered nurse and a professor at the Université de Moncton in New Brunswick and has spent the last 33 years working with older adults living at home in the community. So welcome, all of you. I'd like to invite Sandy and Joanne to join us on screen. If you could turn your cameras on and unmute. And then we'll advance to the next slide.
There we go.
And there we are. Good morning. How are you?
Morning, everyone. We're doing great on this snowy morning in BC.
Welcome. I heard there was a little bit of white precipitation. I'd like to hand it over to you, if you don't mind taking us through your program.
Sure. Maybe if we can go to the next slide. This is our beautiful new building that we've been at for 2 years. We can go to the next slide. And you've already introduced us, so thank you very much. And to the next slide, we're just going to start by giving you context of where we work, a little bit about our communities of Maple Ridge and Pitt Meadows. So our community, we're surrounded by water on the south and mountains on the west. We have plenty of outdoor spaces here, lots of parks, hiking trails, camping sites, so beautiful community. A lot smaller, so we do lack some of the specialists that a lot of the seniors need, that we have to take them out of our community to get to. So just a little bit. So our Maple Ridge, going to Maple Ridge first, our population is close to 91,000 individuals, with close to 20% being seniors over the age of 65 years old. And of course, as we all know, in all of our communities, that's projected to grow significantly over the next 20 years. We also have in Maple Ridge, we have quite a few small pockets of smaller communities. We have Webster's Corners, we have Ruskin, Wannock, Stave Falls, Silver Valley, Hammond, just a number of smaller communities within our Maple Ridge Pitt Meadows that really, where seniors live there, they're much more geographically isolated, even though our population doesn't seem large. They are much more isolated and not on bus routes, so difficult to get around. Next slide. Pitt Meadows. So Pitt Meadows is quite a bit smaller than Maple Ridge. It's just our neighboring community. We have, what did we say we have? We have about 19,000 in Pitt Meadows versus the 91 in Maple Ridge. Again, close to 20% being seniors over the age of 65 years old. Pitt Meadows is known as the blueberry capital
Blueberry
of Canada.
capital.
80% of the land is agricultural, lots of farming, and also on the land we have Casey First Nation who reside in Pitt Meadows. So yeah, just beautiful communities.
It's a little easier for seniors to get around in Pitt Meadows because it is a smaller community and they are on a bus route. Every street practically is on a bus route.
Next slide. So we want to first talk about how we got started. So our social prescribing program is one of a number of seniors programs that we have here at Community Services. And this program we started in 2021, where we applied for funding through the United Way of BC, funding provided by the Ministry of Health, managed through the United Way. So we received funding for a social prescribing program and were successful. We started with 19 pilot projects in BC, so we were one of the 19, a brand new thing for BC. And having started this, we were very fortunate position that we have spent numerous years trying to get closer with collaborating with physicians in our communities. It's has been very difficult. What do you call them?
The gatekeeper.
We have to get past the gatekeeper, the receptionist.
Gatekeeper. Yeah.
So we had a very good relationship with the physicians. They knew about community services. And then you want to take it from there? Our champion of Dr. Park.
Dr. Park. Dr. Park is based in White Rock, and she is a great champion of talking up social prescribing. And she created these lunch and learn programs that we were doing with physicians. Physicians would get lunch delivered to their house or to their office. They would get on the Zoom and we would talk to them for an hour about social prescribing and how it works. Dr. Park was also spearheaded getting social prescribing introduced into the local assisted living in Maple Ridge. We got into Royal Crescent Gardens, and we were the pilot project for it being put into assisted living facilities, and it took off, it exploded, and it took off, and it went really well, and then it got introduced into all the other assisted living in the Lower Mainland. Next slide, please. Oh, yes. We work collaboratively with lots of community partners. Salvation Army is one of them. I have some senior clients who are caregivers for their grandchildren because both of the parents are incarcerated. Salvation Army has summer programs that we've registered the grandkids into, and they also do back to school backpacks and help with clothing. We also work a lot with the Salvation Army. We do a very large Christmas lunch for 300 seniors, and the Salvation Army does all the preparing of the food. And we also have some programs that we run outside in the park, and they do provide box lunches for us. Hospice Society is another great resource to have in your back pocket because they provide counseling for seniors that have lost their significant other, which can be their partner, their spouse, their family pet. And they also have rooms available for seniors that are coming out of the hospital in care and they live alone and they don't want to be alone while they're on their recovery process. So they can book a room and stay at hospice and be well looked after. Fraser River Indigenous Society is another good one because we have Casey First Nation in Pitt Meadows. I get referrals, seniors over to me from Catesy that have lost their status card or misplaced their status card. And Fraser River Indigenous Society can help them with that. And they also have women's circle groups, and they also have counseling services as well. Alouette Addictions is another one. Alouette Addictions is great for helping. They help addicts in the communities, but they also provide service for helping people find housing. And you do not need to be an addict to access their housing resources. Like every other community, housing is always an issue. And Alouette Addictions does what they can to help. You can talk about the Seniors Network.
So, as you can listen to Sandy, we spend a lot of time collaborating with other agencies. We have a seniors network. We call it the Maple Ridge Pitt Meadows Catesy Seniors Network. And it's a planning table of anyone and everyone who work with seniors in our community, whether you're a senior yourself, a representative from the city, for-profit agencies, nonprofit agencies, that we sit around the table. We talk about the needs of seniors, we cross-refer, we identify gaps, and then partner on funding. So we brought in thousands of dollars of funding for programs in our community. So it's very important for any of these programs that we don't work in isolation without working with the whole community. Next slide. So how have we evolved? So being one of 19 pilot projects, being the first program to pilot in an assisted living facility, we've had a chance to learn about the information that we need to collect on intake forms, how the referral process works, follow reports to physicians. So we were able to test out the different tools that we had, adjust them. And then from there, we introduced, or Dr. Park introduced to the program to hospitals, respiratory clinics, primary care. And the thing that I can say before this kind of program is introduced is education is so important in making sure that whoever the program is being introduced to, that they understand what social prescribing is and the appropriate referrals for this program. So it's really for seniors who are pretty frail, that if we can work with them in time, that we can delay further frailty. So without the education, we get, for example, inappropriate referrals. For example, Sandy has received referrals of seniors who have cancer and they have a few months to live, and we get a referral form saying they need social programs. They're not interested in social programs. They're lonely, they're scared.
They're interested in counseling.
Yeah. We get seniors who are on oxygen, who are in such a physical state that just to even walk to their front door is difficult for them. So those are the kind of seniors that really we need more medical intervention before and if they're able to come to this type of program. So again, that has evolved in making sure that we educate health professionals and other agencies on what appropriate referrals are. We've adjusted our whole intake process, what's important that we information to gather, and done a safety pre-screening. So when Sandy gets a referral when she goes to a senior's home, she doesn't know what she's walking into. Do you want to explain that a little bit?
Yeah, the pre-screening form came up when I was going to a few places by myself where you have other abusive people living in the house, and you kind of have this moment where it's like, wow, I shouldn't be here. How do I get out of here? So we came up with the pre-screening form on with a few questions on, do you live alone? Are there any pets in the house? Are there aggressive pets in the house? Do you have guns in the house? And yeah, it's important to have more awareness on where you're going, and you can't really work with somebody if you're not feeling safe while you're in there. So the pre-screening form is definitely a good tool to implement into the program.
Go to the next screen, please. Thank you. So other ways that we've evolved just with, again, all of the time we've spent working with other stakeholders is we now have 2 days a week. We have a social worker from urgent primary care that we always say she lives in our building 2 days a week. So she literally, she's here Thursdays and Fridays, works alongside Sandy and our other staff in our seniors department. So it's so beneficial if we come across a senior that needs more help, perhaps needs a home assessment. The social worker will come along with Sandy to do a home visit, and vice versa. If the social worker has some seniors on her caseload who could benefit from our program, then she refers.
She refers a lot over to me. She's a fabulous resource. She's come with me to a few senior clients who want to fill out their form for MAID, which is medical assistance in death. And the family members were not going to help them. So Maureen has come with me to a few of those, and we filled out the paperwork together and that. So she's a fabulous resource.
We also have 1 day a week. We have a representative from the Social Inclusion and Poverty Reduction in our office. Many of the seniors that we support are not only vulnerable, but they're very low income, and really many of them don't know how to fill out the forms to access like old age security and other financial benefits that are available. So she's able to help us, come with us to support seniors to fill out that paperwork. So again, all of these collaborations, mutual clients, it's been just absolutely a game changer for working with seniors. Next slide, please. So on to lessons we've learned. Well, first of all, I know when we first talked with Healthcare Excellence Canada, we talked about underlying health issues for low-income seniors. We have seniors being referred to us for social prescribing, for support, needing transportation, needing socialization, and they have all these underlying health issues that are a barrier to engaging them with our programs. Again, Sandy talked about seniors who have lost a significant loved one, depression, needing counseling. We have seniors who they can't even eat properly because they're in pain from abscessed teeth, from teeth that are decayed. How are we going to bring them out to come to some social club when they have not been to or ever been to an optometrist, and their vision is become poor? They can't see very well. Mobility aids. We had a senior who hadn't had a shower for 2 months because simple, under $50, you needed something to assist him. Hearing loss. I think everyone can probably recognize all of these things that they've probably seen with seniors, but hearing loss and not being able to afford hearing aids. Food insecurity. How many seniors who Sandy's gone to see that have no food in their home? They don't know how to register for the food bank. They're not even able to cook for themselves. Prescriptions. You have to choose between
Paying their bills.
Paying bills or getting your prescriptions. The bills come first. So that we recognize this a huge issue that we needed to work on addressing. Next slide, please. So we mentioned, of course, the importance of collaboration. We learned that when we receive referrals, Sandy might want to say what the form says isn't necessarily what you're walking into.
It's always more. It's always more. What they tick off on the form is never really what the senior is actually needing. It's what people think the senior needs. You spend 10-15 minutes talking to the senior and you realize it's more. It's a whole different story.
You mentioned knowledge of resources, so important to know everything that's in your communities. And going back to these barriers that we identified, we spent a lot of time looking at funding opportunities, making presentations to service clubs, to donors, to where we are today. We have a health and wellness fund. So health and wellness fund from these efforts, we've been able to pay for counseling for seniors. I don't know how many seniors we've been able to support with dental work.
Glasses.
Sandy and I literally carried one of her seniors down the stairs, took her to the optometrist and got her some glasses.
She could not see 2 inches in front of her face. And when she got glasses, she's like, oh my God, I'm beautiful. And then she cried. So it was pretty special.
So we've used this fund. We've bought prescriptions, we've brought in food, we've gotten free hot meals delivered to seniors.
Helped with rent.
We've helped with rent. We've helped with deep cleaning. So housing, again, we all know is a huge issue. We have seniors who have been at risk of being evicted because their house is in a state they couldn't look after it. So paying for the deep cleaning. And now we've, as of 2 weeks from now, we're gonna be fortunate to have additional funding to now have 2 of Sandy's. Because the referrals keep coming in every day. And if we go to the next slide, Sandy's gonna just share a couple of our success stories, some real life success stories, and starting with Mary.
Yeah, we'll start with Mary. Mary is a gift to know. Mary was referred through 811 at the beginning of COVID, and Mary lived in a basement suite with a very volatile landlord who would go through Mary's things when Mary was out, would go through her fridge, would try to put the rent up all the time on Mary. And when I contacted Mary, Mary had decided that that was going to be the day that she would just lay in bed and she would die, because she was extremely depressed, had no food in her house at all. She had in her house 2 cans of tuna. That was all the food that she had. So I phoned Mary that day, and Mary decided to answer the phone. And she's like, oh my God, somebody's phoning me. So got a very large grocery list from Mary, took her groceries. We refilled her fridge, put food in her cupboards, got her registered for the food bank, got her registered for wellness visits from somebody and wellness phone calls, got her rent subsidized, so she had a little bit of extra money in her pocket, and started getting Mary more active in community things. Mary now lives above us. We have 94?
Yeah.
94 affordable housing units upstairs. We secured a unit for Mary. So Mary's all moved out, moved into a nice little apartment, and is making friends and likes to say that we brought her back to life. Mary's a gift.
I know that we're running past our time, so go to our last slide. And just very
A
briefly.
little quick talk about Les and Jerry Hartwell.
Very quick talk.
Yeah, very quick talk about Les and Jerry Hartwell. They actually live in our unit up, one of the units upstairs. Jerry, the wife, had had a stroke and they needed a handicapped unit. We secured a unit for them, got them moved into a nice apartment, got them food bank delivery, Meals on Wheels, and they will soon be starting with the light housekeeping.
I think that's about it.
I think that's about it.
Sorry that we went over. We just have a passion for working for seniors. So I will end there and thank you, everyone.
Thank you so much, Joanne and Sandy. The work you do is a gift. It comes through, it really shines. And I think what you've helped us to see, in your example of your implementation of social prescribing is the importance of partnerships, that it's not your organization alone, it's your organization in partnership with so many, and the value of establishing and creating those partnerships in support of our communities is so powerful, as well as the flexibility, right? The ability to really provide person-centered responses to individual needs is key to enabling aging in place. So thank you for that very heartfelt, authentic sharing of your senior social prescribing program, and lots of questions in the chat. So depending on time, we'll connect you with some of them today, and then we'll have answers to folks' questions in our follow-up email. And now I'd like to invite Suzanne and Trissa to come on. And if we can move on to their slides. And we'd love to hear about Nursing Home Without Walls. Good morning, good afternoon. How are you?
Good. Thank you.
Good. Let me just hand
Morning.
right over to you both. Thanks so much.
All right. Thank you so much. And thanks for the great presentation, Joanne and Sandy. It fits really nice with what we have to present about Nursing Home Without Walls. I'll go to the next slide. So Nursing Home Without Walls began really based on research that I was doing on aging in place. I've been involved in aging in place, I think even before it was named aging in place, in the early 2000s. And through hearing many stories, doing interviews with older adults, with their care partners, was always, I guess, hearing the same challenges to aging in place, that the services were difficult to access or that there were no services. There was also some social isolation and loneliness among some, issues around home maintenance, transportation, as has already been mentioned, and many others that kept coming back and back. And it came to one point where we wanted to find a solution. And at that time, I was working with the province of New Brunswick, where we're at, and developing a provincial strategy on aging. And had in mind a lot around what needed to be in place, but for it to be economical and to try to use what was already in place to leverage that, and had a conversation with the Nursing Home Association here in New Brunswick, who was also, I wouldn't say struggling, but questioning their place in all of the discussions that was happening at that time in 2016, 2017 around aging in place. And so through some brainstorming, through some all kinds of discussions and whatnot, came to the idea about what would happen if nursing homes could actually deliver services in their local communities, but for people to age at home. And at first we laughed it off and said, oh, what a crazy idea. And the more we thought about it, the more it actually made sense. And so after presenting it to an AGM of the Nursing Home Association here in New Brunswick, I received a call from a nursing home director who had listened to my presentation and said, we want to do what you talked about. And that's how Nursing Home Without Walls really got started. It was a need that was identified in communities where nursing homes were. And through this new, I guess, idea, this new innovation that we were talking about, was to use nursing homes with the resources that they have, with their knowledge of the community and their closeness with the community as well, to use that and to be able to access and provide services to older adults in those local communities. And what we heard was really what shaped Nursing Home Without Walls. It was around people knowing someone who could definitely benefit from having some supports, from having some navigation to services, to having services in the nursing home. And Teresa will give you more in a few minutes on that. But we saw that it spoke to people. And so 4 communities were part of a pilot project that was funded here in New Brunswick as part of the Healthy Seniors Pilot Project that it was called. Nursing Home Without Walls was one of the first projects to be funded through that initiative in the province. We had 4 pilot sites, the Acadian Peninsula, so northern New Brunswick, as well as southeastern New Brunswick, the community of Port Elgin. The pilot sites ran from 2019 to just last summer as well. And we're happy to be here to tell you a bit more about what it is that we are doing within Nursing Home Without Walls. So I will leave it to my colleague Teresa to give you more about what is happening in the community of Port Elgin. Teresa, over to you, and you can change the slide as well.
Thank you, Suzanne. So in the community of Port Elgin, we have in our office 2 seniors navigators, as well as a seniors navigator assistant. And the assistant will help with things like booking, running some of our social activities, answering any questions that any of the seniors may have, and scheduling our transportation program, all that kind of stuff. We also have recently hired a full-time personal support worker at our disposal. And this worker will be assigned to a family. They'll go into the home, and it's on a temporary basis. Basically, we needed somebody to cover a gap. So when we have a family that's needing a little bit of long-term care help at home with things like housekeeping, meal prep, one of those lifeline medical alerts, that sort of thing, while the application process is happening, it usually takes about 6 to 8 weeks. So our PSW is now able to go in and on a temporary basis help out this family while their at-home programs being approved. Along with our full-time employees, we also have an amazing community of volunteers in the area. We have been very blessed that the community comes out in full force anytime we need anything, from helping a senior to get their wood chopped to our volunteer telephone calls, to going and spending time one-on-one with the senior who's lonely and isolated, through our buddy program and also our caregiver support program. All of our employees, our staff, our volunteers have all passed vulnerable sector police clearances, and they've all also signed oath of confidentialities, so we can ensure that the seniors that are using any of our volunteers have been properly screened, and they can feel safe and secure, that the people that we send into their homes they can trust. And we're all a big happy family here. If you want to go on to the next slide. So it might be a little bit hard to see, but we have an awful lot of programs up and running. I will just go through a little bit. Our main goal is to provide support to all the seniors living within rural southeastern New Brunswick. And we can help them from anything to foot care all the way up to, getting their roof fixed because they have a leaky roof. To date, as of yesterday, we have 414 registered seniors in the program. And some of the activities that we offer, we have exercise groups that now run twice a week, led by a senior exercise instructor. We have weekly coffee groups. We have our buddy program, which matches volunteers with some of our single isolated seniors. And that buddy will go and spend time with them, take them out for errands, do whatever they want. We have one pairing that's matched up, and the senior has always sewed all her life and her buddy has always wanted to learn how to sew. So that's how they spend their time every week. We also have our caregiver support program. That program provides caregivers, primary caregivers, which are usually a couple. One senior is doing everything while the other senior needs help at home. So the volunteer goes and spends time with the senior that needs the care, at least for a minimum once a week for 3 hours at a time. And this allows the caregiver to get out of the house, go for a walk, have a nap, run some errands, get their hair done, whatever it is that they have not been able to do through the week. And that program has been proving to be very successful, because just that little tiny break once a week, knowing that their senior at home is being well taken care of and cared for, it's really helps to relieve their anxiety and stress. We also have games day at the local library for seniors, bingo afternoons. We have weekly telephone calls where again, we match a volunteer with a senior who's mostly isolated, and sometimes that telephone call once a week is the only person that that senior will talk to. And those calls can take anywhere between 5 minutes or an hour, depending on how much the senior likes to chat. We have educational lunch and learns, our monthly newsletter, pen pal programs with some of the elementary school students, usually ages 3 and 4. Our seniors absolutely love receiving some of the cards and letters they get from the students. And we have lots of intergenerational programs as well, mainly through Mount A students as well as the local elementary school. We can offer free transportation to all medical, dental, vision, hearing, legal appointments. We have recently just partnered with United Way in Moncton. And through that program, our registered seniors that would like the meals, they receive 40 meals a month for $40, so $1 a meal. And those are delivered right to their home by one of our volunteers. We have our personal support worker, weekly telephone calls. We have our free medical equipment loan program. Again, our community is absolutely amazing. So we receive lots of medical equipment donated from the community. And pretty much as soon as it comes out the door or comes in, it goes out to the door to a senior in need. We also have our hearing aid refurbishment program, where we collect used hearing aids. A lot of times they've only been used once or twice because they end up in the drawer of a nightstand. So those donated hearing aids, we have hooked up with a local hearing clinic that will refurbish and fit those hearing aids for a couple of $100 instead of $2,000 to $5,000, depending on the type of hearing aid that the senior needs. We have safety at home specialists to go in and do a little assessment. And we also depend on a lot of our partners, like our extramural partners that can provide, with a referral from us, can provide occupational therapy and physiotherapy at home. We have, right now, we are working on attaining our age-friendly recognition program. We have partnered with the mayor and the town council, so we're one step away from obtaining our age-friendly recognition in our new community of Straight Shores. And some of the other things that we could do as far as the navigator roles, we can help to apply for programs through, for example, social development. They have 3 amazing programs that will help with emergency and non-emergency home repairs, modifications to the home that are needed for medical reasons, as well as minor home repairs that are offered, that are needed, but they just need a little bit of help in getting those repairs done. There's lots of programs that are available in New Brunswick for seniors. It's actually quite impressive when you go through the list. MB Power will go in and they will insulate a senior's home completely for free. maybe provide a heat pump if needed. We can help them to apply for that the new Canadian dental benefit, New Brunswick prescription drugs benefit, applying for all government programs like the income supplement. When seniors transition from 60 to 65, I can help them get their OAS and their government income supplement going. Property tax credits, the list goes on and on. There's tons of different programs and services that we can help the seniors with. Next slide, please.
And that's back to me. We're playing tag here. In addition to what Teresa was saying, I just wanted to add that Nursing Home Without Walls is almost really an umbrella program where each community can design their own Nursing Home Without Walls program. So Teresa's describing what is happening in one community, while in another community, it may look slightly different. In some communities, older adults are can go into the nursing home to get hygiene care, to participate in social activities as well, stay for lunch and go home with a few meals, because that was the priority that was identified in that community. And so that brings me to say, we talk about what's the secret to the success, or what's the secret sauce. And I actually put it that way on this slide, because I think that there are three major pillars, if I can say, that are the secret sauce. And one that is not on that slide, but is definitely the secret sauce with the cherry on top, is the employees that are part of Nursing Home Without Walls. The Teresas and the Darlenes and the others who are all part of Nursing Home Without Walls are making such a difference, but they are also so dedicated and see the impact that the program is having. And that is so motivating, I have to say. And others than the employees, it really is a program that is community based. It respects the health and social needs of older adults and their care partners. There is no ticking boxes. It is very much listening and trying to support and also empower, so that they do it by themselves and that we are not necessarily taking over, but we are assisting them in taking that responsibility, or giving them the opportunity to do so. And we're leveraging the expertise and the infrastructure and the resources of the nursing home as well, and other partners in the community, because another one of those ingredients to the secret sauce is there is no duplication of services. We absolutely cannot, in in the state that our healthcare system is in, have room for duplication of services. And so we make sure to collaborate and partner with the local community, but also the provincial government and whoever is, in available, I guess, to support the needs of those older adults. It is also, as I said, a very flexible program, person-centered. We try to make it very accessible and equitable as well. And it's really the ongoing understanding of the needs. They really change. And I remember at the beginning of our program of Nursing Home Without Walls, having Teresa there, because she's been there right from the start in 2019, and seeing how we started with something and look at what we're doing now. And it's because we're always listening and trying to understand the needs as they change. And as the priorities change as well, the community does get older a bit with time. We've been doing this for 4 years, and so we've had to adapt it as well. And I honestly believe that those are the secret ingredients to our success. Teresa, back to you for a few testimonies. And I know we have just a few minutes left.
Thank you, Suzanne. So we'll go to the next slide. And just to pick up from where Suzanne said, myself as a navigator, the passion and the love for working with seniors is a key part of our secret sauce, and the ability to adapt and change as need be. So how do we know that what we're doing is working? I have a few stories here. We had to pick through multiple, but I'll just quickly go over a few, and I'll try not to get choked up because, like I said, I have a passion for for these seniors and the program itself. One senior wrote to us and said, "I just wanted you to know that the exercise class was great fun for mom and me this morning. What a great group of ladies. And Brenda, our exercise instructor, does a perfect routine. She makes it so much fun." We got this nice note from one of our seniors, dear Tris and Darlene. I was just sitting and looking through my mail. Your calendar and newsletter for January has just arrived. I wanted you to know how impressed I am after reading it. I'm impressed with all you do for people in our community on behalf of Nursing Homes Without Walls. The Random Acts of Kindness article really caught my eye. So here's a kindness card for you. And this is where I get choked up. The world would be a much better place if everyone followed these principles you are suggesting. Please keep up the great work. I hope you get lots of cards like this to recharge your batteries. Warm regards. And it certainly recharges our batteries for sure. The next one, this sweet lady, Bertha, she's holding one of the cards that she got from one of the elementary students. Good afternoon. I just wanted you to know how very much I look forward to and enjoy the exercise class. Brenda is so upbeat, always smiling, laughing, and totally lifts our dropping spirits. It may be a seniors class, but I assure you, we all get our heart rates up and we stretch every single part of our bodies, including places that we don't know we had. Thank you very much for organizing such a lovely class. And the last one I'm going to share with you today, dear Teresa and Darlene, thank you for hosting the Lunch and Learn today. I think everyone really enjoyed themselves as much laughter was heard all around. It's so lovely to catch up with people I've not seen in a very long time. The event was super well organized from beginning to end. Thank you, Teresa and Darlene, as well as thank you to Max and Denise for their very informative talk. The seniors in our area are very lucky to have Nursing Homes Without Walls looking after us. So that's just a few samples. We get lots of kind messages from not only the seniors themselves, but from the family members as well. It just kind of makes what we do a little bit easier. I'm just going to pass it on to Suzanne, and she's going to just sum everything up for us today.
If you can give me 30 seconds, Andrea, I'm wrapping it up. Last slide, please. I did put in the chat how it was funded. So just to say where we are now, so from the pilot project and the impact it was having, our provincial government actually adopted and is now spreading Nursing Home Without Walls to 20 sites. And we've partnered with Healthcare Excellence Canada as well in doing that. And we are currently having national discussions with other provinces and non-governmental groups as well who are interested in spreading Nursing Home Without Walls. And so from pilot project to program, and you can see the passion that we have. We could talk about this for hours, and I'll end it there. Thank you so much.
Thank you both, Suzanne and Teresa. And we could listen to this for hours in all honesty. And I'd love to spend more time really highlighting the importance and the value of the elements that you've shared. But I want to connect you with some of the questions from the audience. As it predicted, there are so many. So the way that we're going to do this is that all of these questions will be sent to the presenters, who will have a chance to take the time to respond to them thoughtfully, and will share all the answers back sometime later next week. So just rest assured they'll all be answered for you. Also, just noting that both of these initiatives have been featured by Healthcare Excellence Canada in our Promising Practices write-ups, which are on our website, and we'll pop that in the chat for you. So that also will have some of the answers to your questions and provide you with a nice overview of both of these two programs. But one of the first questions that came in for both topics has to do with referrals. And so for social Prescribing. If you want to join us on camera as well, Joanne and Sandy, we had a question around, what organization handles the referral process, and how is that piece funded? And then next we'll go over to you, Suzanne, to ask to talk a little bit more about the referral process in Nursing Home Without Walls. So Joanne and Sandy, do you want to talk about who does the referring?
Yeah, sure. I can start, but our referrals come from physicians, nurse practitioners,
Occupational therapists, respiratory clinic, urgent primary care, geriatric team, social workers, outreach workers, Alouette Addictions, Salvation Army.
so far and wide. That list of other agencies that we collaborate with, they come from them as well.
Assisted living,
Assisted living, and some from even a landlord concerned about a senior.
or a neighbor.
And all the referrals come into Sandy, so we have all electronically. We have a faxed email account, so all referrals are emailed to Sandy, and then she takes it from there.
Thank you. And can folks do self-referral as well?
I was just going to say that.
Yes.
They can self-refer, and family can refer them as well.
If we get a self-referral or family, we try to find out who their family physician is and get consent so that we can connect with the physician so they know that they're involved. Some don't have a physician, so Sandy helps them find one. Yeah.
Wonderful. Thank you. And Suzanne and Teresa, in terms of referrals in your program, can you talk a little bit about that?
Teresa, you want to go?
Yeah, sure. Very, very similar. We receive referrals from the seniors themselves, from family members, MLAs, extramural. We have a very close relationship with all of the social work departments at all of the local hospitals, community members, family doctors, anybody who basically works with seniors one-on-one on a daily basis. We're pretty much receiving referrals from any of those organizations or community members.
Thank you both. And the another sort of common question across both of them as well is related to transportation and your ability to provide those services. I'm getting a sense from the audience that a lot of folks want that for older adults in their communities. And so if you want to talk about what's allowed you to provide transportation services in terms of funding and other resources, I think folks would like to hear about that.
Sure.
Who wants to go first?
You go ahead.
Okay, so for transportation, we link up with our Better at Home program. As one resource, we have some volunteers who do transportation. We have also reopening our account with a local taxi company because, maybe some volunteers aren't available, so then we're going to have that source. And we are also newly going to be collaborating with the Senior Center here in Maple Ridge, where we'll be able to access a wheelchair accessible bus for other forms of transportation. So that is coming up, that we are going to be collaborating with that.
We also have Handy Dart out here. So we, I don't know what it's like there, but in each community, it's a different application form for Handy Dart out here. So we help them fill out the Handy Dart application, go over how the Handy Dart works with them, and Monday through Thursday out here in the Lower Mainland, seniors can ride the bus for free out here. So.
Wonderful. That's great. And Teresa, do you have just a 30-second snippet of transportation?
Yeah, absolutely. So thanks to full funding through social development, we're able to provide free transportation to all medical, dental, vision, hearing appointments. We have 2 full-time drivers and 3 part-time drivers, 5 part-time drivers, I'm sorry. They all have extra insurance taken out. They all pass vulnerable sector police clearance. And transportation, it was a huge issue. It was the #1 issue in our area because there are no taxis, there are no bus services, there's nothing available. The other thing that we have done is partnered with an organization across the border in Nova Scotia that helps to provide any of our dialysis patients transportation to Moncton, which is about an hour away for most of our seniors. And that partnership has proven to be very successful because when they're on dialysis, they have to go 3 times a week. And with no family or transportation in the area, it's really difficult for them to do that.
Absolutely. Thank you so much, everyone. I wish we could stay longer. If I could ask you to move to the next slide and pull up the poll, please, if you have a minute, to just let us know some feedback about your experience with this webinar, and also mark your calendars. Our next one will be March 27th. We'll have 2 different innovations, one on naturally occurring retirement communities and the other one on the NAV Care program, both really exciting initiatives to share. And if you want to go to the final slide, just wanting to let you know that we love hearing from you. Your feedback is invaluable. If you want to get in touch about anything that you heard today, if you have any requests for future webinars, please reach out to us. We're always pleased to connect. So thank you once again to our speakers. Fantastic job, so inspirational. What a beautiful shining star of work that's happening here in Canada. Thank you all, and until next time, stay connected, stay well.